Hi, and in this MicroVid, we'll be continuing on with the topic of breathing mechanics. Specifically today, we're going to introduce two different disease states and compare those to a normal state. So we have a total of three states: normal, someone with emphysema, and someone with pulmonary fibrosis. So why talk about emphysema and pulmonary fibrosis? Well, these disease states are opposites in a manner of speaking, in that someone with emphysema has a decreased lung recoil, and someone with pulmonary fibrosis has an increased lung recoil above normal. And normal is just normal. So let's start with emphysema. During emphysema, you have breakdown of the alveolar walls. So here we have a cluster of alveoli, poorly drawn. However, with emphysema, what happens is that these alveoli are interdependent upon one another, meaning they share walls. And in fact, there are holes, which are called pores of Kohn, in between the alveoli. Now what happens with emphysema is you get a breakdown of those walls. So you get a breakdown of the walls connecting these two, and you get a breakdown of the walls, for example, connecting those two as well. So what you end up with is something like this. So you get alveoli that are sharing a larger space. So air is freely moving throughout this entire space. Now, the result of this is decreased recoil of the lung. And this is decreased recoil for a couple of reasons. When you get breakdown of that wall, it's due to macrophages coming in and secreting elastase, which breaks down the elastin in the walls. So you have decreased elastin, and that's going to contribute to the decreased elastic recoil that we see. So with patients with emphysema, they actually have an easier time inhaling. However, they have a harder time exhaling. Now, another thing to note with emphysema is that not only do you have decreased recoil, but you have increased compliance, meaning stretchiness, or the ability of the lung to stretch. Think of it like this: if you've got both hands together and you have several, say you have 5 rubber bands around your hands holding them together. If you were to take 3 of those rubber bands off, you would have an easier time stretching or moving your hands apart. That's kind of like a measure of compliance. Along with an increased compliance, patients with emphysema have an increased residual volume. Now this makes sense because you don't have as much recoil from the lungs, so therefore you'll have an increased FRC. And then also an increased total lung capacity as well. So when looking at emphysema, I find it helpful to look at the spirometry tracing for visualizing the effects that a patient with emphysema would have compared to that of a normal patient. So let's go ahead and look at that. Here we have a picture of the lungs and the chest wall, as well as a spirometer trace. Now remember that FRC, which is functional residual capacity, this right here, is at this point, and it's at this point due to 2 factors. Outward recoil of the chest wall and inward recoil of the lung are balanced at this point. So FRC is a result of the outward recoil of the chest wall and the inward recoil of the lung. So there's a balancing point. For example, if we have the inward recoil of the lung, this is in, and the outward recoil of the chest wall, that's out, Where those balance, that balancing point is FRC, functional residual capacity. If you were to upset that balance, such as in a disease state like emphysema, what you're doing is you're decreasing this inward recoil. You're actually decreasing it. So instead of being that size of an arrow, so instead of having that much inward recoil, say it only has this much. So what will happen now if you have, and if the arrows are indicating magnitude, what happens if you have a lot more outward recoil and only a little bit inward recoil? Well, this FRC will shift. It will shift this way until a new balance point is reached, and that's exactly what we see. So with functional residual capacity, during emphysema, we see FRC increase, which is what we mentioned up here. So FRC will increase during emphysema. Residual volume as well increases, and that makes sense, right? Because the residual volume is the volume of non-exchangeable air in the lungs, and if FRC is going up, well, residual volume will move up as well. And then finally, total lung capacity will increase. What is happening here with total lung capacity is, since you're shifting FRC, you're shifting residual volume, and you're basically decreasing the recoil, the inward recoil of the lungs have a greater ability to expand even beyond their normal maximal value. So that is emphysema. Now, let's move on to pulmonary fibrosis. Pulmonary fibrosis has the opposite effect on the recoil of the lungs from emphysema. Whereas emphysema decreases the elastic recoil on the lungs, pulmonary fibrosis actually increases the elastic recoil on the lungs. With pulmonary fibrosis, you have an increased elastic recoil, a decreased compliance, a decreased residual volume, a decreased functional residual capacity, and a decreased total lung capacity. Pretty much the exact opposite of what you get when you have a patient with emphysema. So with pulmonary fibrosis, you have increased fibrin and collagen deposition on the lungs. Think of it this way. If a normal lung, if you put your two hands together and you put 5 rubber bands around your hands, right? That's a normal lung. With pulmonary fibrosis, it's like putting, instead of 5, you're adding 3 more. So you'll have increased lung recoil. So if we are looking at that on our depiction right here of the lungs, if this is lung recoil, a normal lung recoil, and the arrow indicates strength, and this is outward chest wall recoil, they're balanced. And at this balancing point, once again, you've got FRC. Well, now what we're doing is we're adding lung recoil. So we're adding lung recoil. So no longer is it what it used to be, it is now increased. Therefore, what happens to FRC is FRC shifts. So now FRC is no longer at that point, but maybe it's at this point. What does that do to a spirometry tracing? FRC will move down. This point right here where FRC is, because we have increased lung recoil, FRC will move down. So maybe it will move down to this point. What does that do to residual volume? This point at residual volume will move down as well. So you have a decreased FRC, a decreased residual volume, and because you have increased lung recoil, what this does is it actually decreases the maximum amount by which you can inspire, volume-wise. So total lung capacity will decrease as well during pulmonary fibrosis. So you've got a decreased in lung recoil, a decreased compliance. The lungs are no longer as stretchy because you have increased fibrosis. You have decreased residual volume, decreased functional residual capacity, and decreased total lung capacity. Once again, this is just an overview of these two different disease states. Respiratory physiologists come back to these two disease states because, as you can see, they are opposites in how they affect the physiology of the lung. I hope that this has been a helpful introduction to pulmonary fibrosis and emphysema.